What is irritable bowel syndrome? Irritable bowel syndrome is a chronic condition that is estimated to affect 15% of the population, with females being affected twice more than males. Possible factors that may contribute to irritable bowel syndrome include food allergies, lactose intolerance, excessive consumption of wheat bran, parasitic infections or candidiasis, medications especially antibiotics, metabolic disorders such as hypothyroidism, and psychological factors such as stress, anxiety and depression. The Irritable Bowel Syndrome Diet. Irritable bowel syndrome, IBS, is a functional disorder of the digestive system, unrelated to any structural defects. The most common symptoms of IBS: pain or bloating in the abdomen, irregular frequency of bowel movements, constipation, diarrhea, abnormally large mucus secretions from the colon, flatulence, nausea, loss of appetite, headache and depression. Treating irritable bowel syndrome with food. We all know that the treatment for most diseases of the digestive system in general, and irritable bowel syndrome in particular, is through food and a commitment to eating healthy food away from mixing and diversification. Here are some foods that can eliminate the disease of the age, which is irritable bowel syndrome. Dietary fiber and irritable bowel syndrome. Increasing your dietary fiber intake may reduce symptoms of irritable bowel syndrome, especially when you have constipation. However, it may be better to increase your fiber intake from fruits and vegetables rather than cereal bran, as this often worsens the condition by triggering an allergic response. Psyllium husk is an excellent source of fiber that has been shown to act as a laxative and anti-diarrheal. Psyllium husk also has a calming effect on the digestive system due to its high mucilage content. You can take 1 full teaspoon up to 3 times a day, mixed in a glass of water. Slippery elm powder also provides a very soothing effect on the lining of the digestive tract and may help relieve constipation in irritable bowel syndrome. You can eat 1 tablespoon of powder daily, mixed with yogurt and honey or mashed banana. Food allergies and irritable bowel syndrome. Food allergy has been documented in at least 2/3 of patients with irritable bowel syndrome. The most common allergens are dairy products and grains containing gluten, and it is recommended that these foods be avoided, at least initially, until the diagnosis is revised. Blood tests to identify allergens are very helpful because a variety of foods have the potential to trigger an allergic response. Digestive support for irritable bowel syndrome. It is often helpful to take hydrochloric acid and/or pancreatic enzymes to promote complete protein digestion. Research has shown that incompletely digested protein particles can enter the bloodstream and cause allergic reactions to foods. These supplements also provide general digestive support, which may relieve other symptoms associated with IBS, such as bloating and flatulence. Sugar, refined carbohydrates, and irritable bowel syndrome. Eating sugar is harmful to individuals with IBS because it reduces bowel motility and contributes to bacterial overgrowth and candidiasis in the small intestine. When there is a sudden spike in blood sugar levels, the normal rhythmic contractions of the gut are greatly affected. It is best to limit the consumption of all simple and refined carbohydrates, including sugar, honey, maple syrup, dried fruits, fruit juice, white flour, and white rice. Probiotics and irritable bowel syndrome. Dietary supplements containing acidophilus and bifidus are indicated because these organisms reduce toxins in the intestine, inhibit the growth of harmful microorganisms, reduce food allergies, reduce flatulence, and enhance general digestive function. The benefit of lemon for irritable bowel. Lemon juice is a good general remedy for improving digestive function. It works as a tonic for the liver and pancreas, improves appetite, and can help relieve nausea. Therefore, lemon is an effective treatment for irritable bowel syndrome. Peppermint treat irritable bowel syndrome. Peppermint works on the secretion of digestive juices and bile and leads to smooth muscles inside the digestive system, and it also relieves nausea, reduces colic and bloating in the abdomen, and works to calm the colon system. Enteric-coated peppermint oil may be of greater benefit for IBS sufferers, and has been shown to be approximately 95% effective in providing symptom relief from IBS. This type of mint is also effective against Candida infection. How to deal with irritable bowel syndrome. Almost all patients with IBS have some degree of involvement in psychological factors such as anxiety, depression, and sleep disturbance. Although, these factors become apparent after irritable bowel syndrome develops and may be associated with digestive disorders, especially malabsorption of nutrients, food allergies or candidiasis. Patients with irritable bowel syndrome also report a reduction in their symptoms when they undergo training in stress management, counseling, hypnosis, relaxation therapy, and biofeedback. Any activity that reduces stress may be beneficial, including yoga, tai chi or meditation. Slowly walking 20 minutes a day has been found to reduce symptoms of IBS, and this may be related to the ability of exercise to reduce stress levels. It is important that the diet is as healthy as possible and that an adequate amount of pure water is consumed. A healthy diet provides the foundation for general well-being, psychological balance, and the body's ability to heal. Diagnosis of irritable bowel syndrome. Research has proven that irritable bowel syndrome is associated with a good prognosis. The quality of the practitioner-patient relationship was associated with a better outcome. When more attention is paid to a patient's psychological and social history, influencing factors and an open discussion of diagnosis and treatment, the patient is more likely to have long-term relief from symptoms. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about irritable bowel syndrome, please visit my own site. You will find the website link in the description. Thank you.